Nearly 188,000 Oklahoma children get their health care insurance through the Children's Health Insurance Program, better known as CHIP. Congress failed to reauthorize funding for the program back on the deadline in September, and so now states are running out of money for the program. Oklahoma's CHIP program will run out of money in just 4 weeks.
There is growing concern that federal lawmakers will go home for the Christmas break, leaving the CHIP program unfunded. To avoid running out of cash next month, the Oklahoma Health Care Authority, which runs the CHIP program, has gone back to the federal government looking for some extra cash.
We have just asked for redistribution dollars from CMS to begin in January. And as it stands right now, we can fund that program through early April.
But once that pool of redistribution money runs dry, if Congress doesn't act, the CHIP program will grind to a halt.
It's scary to think about what could possibly happen with the loss of the CHIP program and how it would impact kids in Oklahoma.
Joe Dorman is CEO of the Oklahoma Institute for Child Advocacy.
Kids Count data shows that 7% of kids in Oklahoma right now are uninsured. We look back to prior to the program being implemented by Congress back in the early 1990s, and Oklahoma kids, the rate was in the teens.
Oklahoma, like many other states, has expanded eligibility to the CHIP program, now up to 210% of the federal poverty level. It ensures that children get coverage whose families make too much money to qualify for Medicaid or to qualify for health care insurance subsidies. But that improvement in health care coverage would quickly dissolve without the CHIP program.
We're being held hostage by the federal government and the state government, by the politicians not taking action at this point.
The headlines across the country lay blame for the failure to renew the CHIP program squarely at the feet of Republicans in Congress. Funding for CHIP expired back in September, and instead of reauthorizing the program and its funding, it got caught in the battle to end the Affordable Care Act and then tax cuts. But Oklahoma U.S. Senator James Lankford says blaming the Republicans is just fake news inspired by the liberal news media.
It's much easier just to do a bumper sticker statement and say, members of the GOP hate children, and then to try to just sweep it out there. What people that actually follow the news and what actually are getting accurate information know is that we're trying to resolve each issue and to be able to get it done in the best possible way.
Lankford insists that the CHIP program will be funded before Congress goes on Christmas break.
CHIP was supposed to have been reauthorized in September. It was not. It was part of the larger health care conversation. I anticipate it will be reauthorized in the year-end funding that happens in the next couple of weeks.
Joe Dorman at the Institute for Child Advocacy is still concerned.
It's frustrating that these adults are acting like children themselves, and it's the children of the state who are suffering.
Eichard Pasternak says once the state is approved for some of that redistribution money by the federal government, the program will remain largely stable for the next few months, but there will still be cuts.
We are considering the elimination of our freestanding CHIP program, which is soon to be Sooners, and some children that are actually covered through the Insure Oklahoma program. For both programs, for soon to be Sooners and Insure Oklahoma, it's close to 4,000.
And without good prenatal health care, some of those soon to be Sooners may never become Sooners.
These politicians, most of whom are mothers or fathers, they're fortunate they have government insurance through their elected position, but they need to remember their constituents who don't have insurance, who are going to suffer.
The criticality of the issue is now, because there are states that are exhausting their funding this year.
For now, at least, the CHIP bill is stuck in the U.S. Senate.
The CHIP bill is still in the Finance Committee. Obviously, they're working through tax policy right now, but the CHIP program is a part of the year-end conversation.
Nationwide, the CHIP program provides health insurance for 9 million children. Lankford says Congress knows they need to act to keep the program going.
That's one of the areas that we have wide bipartisan agreement on. We'll work through the financing aspect of it. I don't think that's going to have an issue being able to pass through the Senate.
Some states are looking to their local legislatures for the cash to keep the program going. Eichard Pasternak says they have brought the issue up to Oklahoma lawmakers as a way to impress upon them the seriousness of the agency's funding needs, which are still short by some $50 million for the current fiscal year. just to provide its other basic Medicaid services. So the chance of any extra state funds for the CHIP program appears slim to none.